Welcome to Chapter 15, Adolescent Nutrition Conditions and Interventions. So this is a pretty short lecture, but we're going to introduce a little bit of a new concept for some of the students where we're going to really start applying what we know about nutrition recommendations in the different life cycle stages and thinking what we might do about the nutrition problems in a more clinical sense. So the objective is quite easy, and actually we'll start to be thinking about something called the nutrition care process because that's going to be really important when you do your second and last case study on elderly nutrition. That's of course not due until the end of the semester, but it is in a little bit different format than what you might be used to. So for today, we're going to practice a bit, and I want you to be able to apply what you know about adolescent nutrition needs and behaviors in a clinical situation. And we're going to have a whole lecture on the nutrition care process, but I do want to introduce the main steps right now. Some of you have had this in other classes, and it'll be really easy for you. And some of it, if you've never had it, it takes a bit before you can sort of understand it. So the process is shown in the picture down here. If you think about, what's the process when we're trying to help someone? So if you had a teenager, let's pretend we have a teenage athlete and she was having a nutrition problem, that would start with either a referral, so some kind of healthcare professional believing that she needs help, or maybe she did some type of screening where they identified she might have a problem. So in that case, we would go on to the second step, which is thinking about a full-blown nutrition assessment. And if you recall, that's where we'd really start to look at her anthropometric data. We'd calculate her height and her weight and her BMI, any relevant biochemical data if we thought we needed laboratory tests, any clinical data if she had any other health issues or diagnoses, and any environmental data, anything about her home life, her school life, her personal life that may impact her nutritional status. So this is done by a nutrition professional. Doing a good nutrition assessment actually takes a long time, and you really want to be comprehensive. The point of an assessment is to determine what's wrong. So using this process, the terminology for that is the nutrition diagnosis, right? You might have a diagnosis of hypertension or anorexia. A nutrition diagnosis is similar to that. It's just going to be something specific that would be treated by nutrition itself. Writing the diagnostic statements for nutrition is a little cumbersome, and so we're going to learn how to do that this semester as well. The nutrition intervention is what we're going to do about the diagnosis, right? So it's a cycle. First, we figure out what the problem is, we give it a name, and then we treat it. We do something about it. A lot of times in the nutrition world, we treat using special diets, possibly supplements. Maybe someone just needs education or counseling. So those are common interventions. And then if we're good at our job, we're going to monitor and evaluate and make sure our intervention works. So if this particular athlete maybe had iron deficiency anemia, we would figure that out. We would give her that diagnosis. We would decide if she needed supplements or dietary interventions or both. And then we would monitor and evaluate to make sure that that worked. Most likely, we would be monitoring her blood work and make sure that her iron status went back to normal after our intervention. So we're going to use adolescent athletes as an example to help us understand the nutrition care process. This is a good example because a lot of our adolescents are in one or more sports, a little bit more for men than females. But if you think about what's going on with puberty and you combine that with high levels of physical activity, growth and development, we really might be seeing some special nutrient needs. So would these adolescents need more energy, more protein, or more select vitamins and minerals? So if you kind of look at these different sports I have pictured here, we've got football, golf, running, and wrestling. Which type of athlete would you be most worried about? Which one of these athletes might have more nutritional problems because of their sport? Um, I think you could maybe start with the least likely, which would probably be golf. I come from a long line of golfing enthusiasts, so I'm not making fun of golfers in any way, shape, or form. But if you think about, the nature of the activity, it doesn't require tremendous endurance. It's not one where having a certain body type or weight is highly valued, or people are, overly judged by that. And then if you see some of these other sports where usually either small size or large size is considered the ideal, and people might do unhealthy things to achieve that. So for football, depending on, I suppose, your position, you might be asked to gain weight or gain muscle. I was a long distance runner in high school and college, and being thin was very valued. Um, these uniforms that we wore were very revealing, and I think there was a lot of pressure to look a certain way, for a variety of reasons, including performance and trying to maximize performance, even though sometimes doing unhealthy things to look a certain way doesn't help with that. Wrestling is probably one of the most dangerous, just because it's so dependent upon body weight. You wrestle in a certain body weight class, and if you don't make weight, you're not able to compete. So wrestlers have been known to do some really unhealthy things in order to make weight. So when you think about, what would you consider for assessing the nutrient needs for these adolescents, you'd really want to know sort of what their goals are, what pressures they may be putting on themselves or getting from others, what sort of practices are they following. They're often very motivated to do well at their sport, and that might mean that they're willing to do unhealthy things that you would want to know about. So here's some more specific questions that you would want to include in your assessment. So you think about the word assess. I use it a lot in all of my classes because it's an important part of what we do when we're trying to help people. Assess is to really take a deep dive and try and figure out all the factors that might be causing the nutrition problem. And depending on the person and their problem and their lifestyle, we might have to add on sort of extra unique questions. So if you think about an adolescent athlete, we wouldn't ask anybody this question, but we'd certainly not want to know what sport they're engaged in, the duration of the competitive season, right? So I was in cross country in the fall, indoor track in the winter, and spring track in the spring. That might be very different for someone who has a much shorter season and only competes during, one of the seasons. What is the level of competition? In high school, it didn't really matter so much. It wasn't nearly as competitive, but once you got into college, certainly there was more training, more mileage putting on in my case, more strength training, and therefore more risk. What kind of training does the adolescent engage in? You'd always have to be careful about adolescents even going above and beyond what would normally be expected of them, and really understand all of the things that they're doing for training um, as part of your assessment. You'd be worried about hydration. That's what this next question is getting at. Are they sweating profusely or losing body weight during competition? That can be extremely dangerous. And then knowing if they follow a special diet, and maybe they only do during certain times of the season, but you'd want to know that. Supplement use is going to be more prevalent in this population. as they may hear things that would make them believe supplements would help, and you would want to know about that as well. So here's just sort of some general nutrition recommendations. So these would be part of your intervention. Most athletes are expending more energy, so they need to consume more energy. A competitive athlete may need 500 to 1,500 additional calories per day, and that number can even go higher than that, depending on the intensity and length of the workouts. We have a group that might be prone to overusing protein, especially if they're taking protein in a supplement form, like a shake or something like that. You would want to figure out what percentage of the diet is coming from protein. If it's over 30%, that's excessive and that's not going to be healthy for them. Another group you might want to watch out for are vegan athletes or other type of restrictive diets, especially in sports where thinness is perceived to be very valuable. I'm showing a picture of a gymnast here. You really want to be careful that you're screening for disordered eating practices or diets that aren't providing enough energy and nutrients to support their training. Other recommendations, they're really not going to be much different from standard DRIs or the MyPlate recommendation. Just recognize that if they are in one of these sports where they're burning more calories, they're going to need the upper limit of all of the food group servings. They're going to need extra energy like we just talked about. They also might need specific guidance around competitive, how to eat around a competition. So a pre-event meal, what to eat and how to time that would be interesting to these athletes. Post-event meals, we usually recommend about 400 to 600 calories, and making sure we're rehydrating by using non-caffeinated fluids. We can even get more specific about what those meals and snacks should look like, but that's important information for them to know. Talk about some of the micronutrients that might be a concern. Calcium is a problem in all teenagers, not even just teenage athletes. If athletes are taking a calcium supplement, they should also make sure they're taking vitamin D with it. That's going to help you absorb the calcium. I always think about this in athletes who are prone to things like stress fractures. There's lots of reasons why you're going to get these small little fractures on your bones, but that's an indicator that your bone health isn't exactly where it should be. Not necessarily that that's the cause, but it can be. So you might want to be worried about calcium and D intake. Another, even though this isn't a micronutrient, dehydration is extremely common. Adolescents tend to, or be more likely to ignore physiological signs of fluid loss, and they might just simply not be aware of how important fluids are. So this graph at the side, this is not from your book, it's something that I found online. But if you think about, NCAA Division I athletes, you would maybe assume that they're getting, a lot of help and support around good nutrition and hydration. But this was a real simple research study, and over half of those athletes were dehydrated. So that message really isn't getting across to our athletes, and that's probably one of the most important things that you would be concerned about. Other micronutrient would be iron. We've talked a lot about iron, iron in this class. Especially among our female athletes. This is going to be a common deficiency that you would run into, especially in a younger athlete if they're still growing in their growth spurt during puberty. You have to think about iron itself, but also vitamin C foods that help absorb that iron. Someone who's also vegan or vegetarian would be more likely to have low iron in their diet. Someone who's really restricting their intake and skipping meal would also be more likely to have a problem. Real strenuous sports, and I would include running and soccer, things where you're really pounding a lot. that tends to also result in iron deficiency. I'm not exactly sure why, but one of the thoughts is that pounding is doing some damage to your small blood vessels, and maybe that's why someone's losing iron. And especially for a female, if she's having heavy periods every month, she's losing blood that way, and it can be hard to maintain iron status. Here's one of our important recommendations about fluid intake. And again, if you were working with athletes, you'd want to really emphasize this. You really want to be hydrating 1 to 2 hours before an event, during an event, especially if it's going to be over in an hour, and then certainly after an event to replenish anything that you have lost. And this is even giving real specific recommendations about the temperature of the water and how much you should have before, during, and after an event. So making sure that athletes understand that would be critical. Some other things that we tend to think about for athletes are special training diets. A lot of endurance athletes use something called carbohydrate loading. So we know that carbohydrates are the easiest for the body to use as an energy source, and we can store carbohydrate as glycogen. We often don't like the idea of storing it. Maybe makes us think of gaining weight, but if you're going to be exercising for a while, you're going to need energy. Otherwise, you're not going to be able to continue that activity. So we tend to have higher carbohydrate diets for these types of athletes. Everyone thinks protein is sort of the magic cure-all for everything. Protein isn't a great source of energy. It certainly has energy and has calories, but it's much easier for the body to use carbohydrates. So especially, again, for an endurance athlete, they need protein, but high protein is not encouraged. Protein does become more important after intense physical activity. So after a really hard workout or maybe an important event, you want to include a protein source to help their muscles recover from that. And usually the sooner the better in terms of protein and recovery. And for a teenage athlete, their protein needs are a little bit higher just because they're younger and still growing. Certainly they're still having muscle growth and repair. So you would want to make sure that they're meeting those recommendations. Substance abuse, of course, can happen at any age, but teenagers are sometimes experimenting with tobacco, alcohol, and drugs that you would need to be aware of. This is relatively common in certain pockets. We also can worry about substance abuse, increasing disordered eating. So I'm showing you a picture of something called drunkorexia, which is not an official disease or syndrome, but it's a practice that younger people engage in where they don't eat, because when they drink alcohol, they'll quickly feel the effects because there's no food in the system. So they'll feel drunk faster, which can be dangerous. Sometimes they also do this to save calories. So they know the alcohol has calories, so they don't want to eat the calories as well. And that can, of course, be incredibly dangerous if you think about alcohol poisoning or other things that can happen with too much alcohol use. Yeah, I believe this is the last slide. So we're just going to kind of talk you through a case study, what you might think about if you were seeing a young athlete. So in our case, we've got a 15-year-old female track athlete, perfect GPA, class president, so really one of those, at least at appearance, high functioning, probably very driven, possibly a bit of a perfectionist type of student. If you look at, what she's doing, she's drinking a lot of coffee, really probably excessive amount of coffee. Not that coffee is so bad, but you would wonder why she would need all of that. Water after competing, that's good, but she certainly needs water before competing as well, not just after. She's on a restrictive diet, so if she's in track, she needs more calories, but she's going, less than what she would even need if she wasn't an athlete. She's really focused on lean protein as part of her diet. She's doing extra training, so think about going to practices, but also running on her own on the weekends, or maybe doing more before or after practice. Her BMI is 19, so that is low. Technically, 18.5 is underweight, but 19 is really close to that. So right away, case studies, you never get all the information, but there's lots of red flags here. And if you know anything about, disordered eating practices, you would immediately start to suspect this. Right? So if this was the real world, and you had this information and you were meeting with this young woman, you would have to tailor your assessment to that. For anthropometric measures, you would want to be very careful. And not making too much of a big deal about her weight or her body fat or where any of that was, because you would be suspicious that she might be very, very concerned with those types of numbers. If you suspected there might be some disordered eating or even a full-blown eating disorder. You would want to know her weight history. So, there's a difference between someone who's always been kind of lean and always had a low BMI, and maybe that runs in her family, and maybe that does seem kind of normal for her, versus someone who has lost a lot of weight. For biochemical, if you kind of think about what lab tests, even if there was no disordered eating, she off the bat has some red flags for iron deficiency anemia. So you'd want to do some of those blood tests and see how that is going. For clinical, you'd want to know if she has other health conditions, if there's anything that runs in her family and might be genetic. For diet, you would do a very thorough diet history, not only a 24-hour recall, so everything she's eaten with the last 24 hours. You'd also want to know her usual eating habits, what she does on the weekends, the difference between eating while she's competing and eating during the off season. If there's any foods she avoids, certainly a deeper dive into how she stays hydrated and why she's drinking so much coffee. If she's really tired, that could also be a sign of iron deficiency. So, you really have a lot of things that you'd have to be talking about. For environment, think about all the things that influence our nutritional habits. Where is she getting her food? Where is she eating? Does she do school lunch? Does she eat with her family, or is she packing everything on her own? Does she have any food access issues? Is she so busy that she doesn't even have time to eat? All of those things that, you would want to be thinking about. In terms of, what you do next, it'd really depend on your assessment and what your goals were. You'd really want some patient-driven goals. So what motivates her? What does she want to see happen? If you did think that this could be an eating disorder, you'd want to involve other healthcare practitioners to make sure she was getting good treatment for that. You'd probably have to follow up and be thinking about a more varied diet and better hydration. So a lot of things to think about. And that is it. I promised you a nice short lecture and I delivered it. So this is the last lecture series in adolescence. We're going to start on adult nutrition next.